Okay, let's talk about something that affects millions and millions of us, but almost no one actually wants to mention out loud. We're going to break down hemorrhoids and give you a super straightforward guide to understanding what's going on and, most importantly, getting some relief.
So, if you've ever felt that pain, that itching, or just this general awful discomfort down there, you know how much it can completely derail your day. It's a really sensitive subject, both physically and, let's be honest, emotionally too.
But here's the number one thing you need to hear. You are so far from being alone in this. These conditions are incredibly common. So let's pull back the curtain, demystify what's happening, why it's happening, and what the actual medical guidelines say you can do about it. All right, first things first. Before we can talk about fixing it, we need to get a really clear picture of what we're actually dealing with. So what exactly are hemorrhoids and their close cousin, anal fissures? Okay, this is a huge point, so let's get it straight right now. Everybody has hemorrhoids. They are totally normal part of our anatomy. They're just these little cushions of tissue filled with blood vessels. The problem, the disease, only happens when they get swollen, inflamed, and start causing symptoms. Now, this table pretty much explains everything. Ever wonder why some people just have some painless bleeding while others are in absolute agony? It all comes down to location, location, location. There's this little line inside, and the nerves are different on either side. Internal ones are above it, where you can't feel much pain. But external ones, they're below that line in a super sensitive area. And that's why they can hurt so much, especially if a blood clot forms inside one. And for those internal ones, doctors have a system to classify them based on how much they poke out or prolapse. Grade I are just swollen, they stay inside. Grade 2 might pop out when you have a bowel movement, but they go back in all by themselves. Grade 3, they pop out and you have to manually push them back in. And grade 4 are the ones that are just out all the time and won't go back. This grading system is key for figuring out the right treatment plan. So now we know what they are. The next logical question is why? Why do these perfectly normal parts of our body suddenly become such a massive problem? You see the pattern here, right? The common thread through almost all of these is pressure. Too much pressure in the lower rectum, straining because of constipation, spending way too long sitting on the toilet, chronic diarrhea, lifting heavy stuff, even pregnancy. It all puts a ton of stress on these veins, causing them to swell and stretch out. And a low-fiber diet, that's probably the biggest villain of all because it leads to hard stools and, you guessed it, more straining. And all that straining can lead to this other problem, an anal fissure. The easiest way to think about it is like a little paper cut, but in the worst possible place, the super sensitive lining of the anal canal. It's usually caused by passing a hard, dry stool, which then triggers this cycle of intense pain and muscle spasms that just makes everything worse. All right, enough about the problem. Let's get to the good stuff. Let's talk solutions. What can you actually do right now at home? The good news is a lot of flare-ups can be managed with some really simple, really effective home remedies. Honestly, this is ground zero for treatment. The goal is simple. You want to make your stools soft and bulky so they pass easily without any straining. That means loading up on high-fiber foods from that left column. And you absolutely have to drink plenty of water. We're talking at least 1.5 to 2 liters a day. At the same time, you got to try and avoid the stuff on the right that just makes constipation worse. This sitz bath. It's a classic for a reason. It works. Soaking the area in warm water feels amazing because it helps relax that anal sphincter muscle, which is a game changer for reducing pain from both fissures and hemorrhoids. The key is warm, not hot water, and you only need to soak for about 10 minutes at a time. So, while warm water is for relaxing muscles, cold therapy is your friend when it comes to shrinking things down. For swelling and inflammation, a simple ice pack, wrapped in a cloth please, applied for just a few minutes can really help shrink those swollen tissues and give you some nice numbing relief. But what if you've done all this stuff at home and it's just not cutting it? Well, that doesn't mean you failed. It just means it's time to call in the experts. There are some very effective medical treatments out there that can provide some serious relief. A doctor might start with some over-the-counter or prescription creams. And yeah, they can be great for managing symptoms in the short term. But, and this is a really important but, they are not a long-term solution. You really shouldn't use them for more than a week or so because they can start to irritate your skin. For those internal hemorrhoids that just won't quit, there are several minimally invasive procedures that a doctor can do right in the office. The most common one is rubber band ligation. They put a tiny little rubber band at the base of the hemorrhoid, which cuts off the blood supply, and it just shrinks and falls off.
Sclerotherapy uses a chemical injection to do basically the same thing, and infrared coagulation uses heat. The best one for you really depends on the grade of the hemorrhoid and your specific situation.
This quote from a medical guideline really nails it. The whole point of these in-office procedures isn't always to completely remove the hemorrhoid. It's really about reducing its blood supply, shrinking its size, and helping it stick back to the rectal wall so it stops prolapsing and bleeding. Simple as that. All right, so for the most severe, most stubborn cases, we're moving into the realm of surgical solutions. Let's talk about what that looks like and, just as important, what you can expect during recovery.
Let's be really clear. A hemorrhoidectomy, which is the surgical removal of hemorrhoids, is pretty much the last resort. It's for patients with those big, prolapsing grade 3 or 4 hemorrhoids, or for folks who just haven't found relief with any of the other methods. And while it is the most effective long-term fix, it definitely comes with a more significant recovery time.
And here's the cool part. Even surgery is getting an upgrade. While the traditional procedures work really well, newer techniques, like using lasers, are aiming for the same great results, but with less pain and a faster, more comfortable recovery. That's a huge win. Look, after any kind of procedure, how you take care of yourself is absolutely critical for a smooth recovery. Gentle cleansing with water, not abrasive toilet paper, is key. And that high-fiber diet we talked about, it's not optional anymore, it's essential to prevent straining while you heal. Following these steps is vital to minimize complications and get back to your life. So when you boil it all down, anorectal health is just a part of our overall health, even if it's one we're taught to be embarrassed about. Understanding what causes these problems and knowing the treatments empowers us to move from just silently suffering to taking proactive care of ourselves. So the real question is, isn't it time we finally started giving this part of our body the attention and care it actually deserves?